Hi, I'm Dr. Pham here at Smiles of Virginia Beach. Today we will be talking about root canals. A root canal is when we access a tooth, remove decay, and remove infected nerve. You'll know it hurts. It hurts really badly and sometimes with swelling. Again, pain is tremendous, okay? And when a tooth gets infected, you have an abscess near the root. And that abscess can spread, particularly in areas that are closer to other important structures. In the head, we have, for example, upper teeth, your brain, sinuses, lower teeth, airways, a specialist, an endodontist. However, here I'm comfortable doing root canals as far back as first molars. That depends. Every tooth is worth saving. Okay. So to me, if we still have a lot of tooth structure left and it's something worth saving, I'm 100% for the root canal. However, when we have an extensive decay that's eaten through, I don't know, more than 60-70% of the tooth, at that point, we don't have enough tooth structure to even crown the tooth after we get the root canal. So therefore, that tooth will have a poor prognosis. Usually, if you need a root canal, you have a very big cavity. Okay, so we drill the tooth, remove cavity, make sure that we have a nice, clean working environment, access the canal where your nerve resides, and then from there we remove the nerve. And of course, you don't feel any of this because you'll be numb. After that, we fill the canal space up with a biocompatible material. And then we put a crown over that tooth to make sure that it's nice and protected. So root canals, when they're done right, they can last for a very long time. However, with that being said, a tooth can get reinfected, okay, and all the symptoms of an infected tooth will come back. And it could be costly if that's something you need to do twice for a tooth. Crowns, 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 all day long. Because most of the time, if you need a root canal, the tooth is most likely very decayed. Unless the tooth is somehow, and it does happen, goes necrotic, just the nerve dies for no reason, then a filling would be a better choice. It's very prone to fracturing, okay, after a root canal, so you want to make sure that we put a crown on that tooth to protect. Now, usually I would give it 2 weeks. Post-op pain / sensitivity is very normal, okay? However, if that symptom persists for longer than 2 weeks, I would call your doctor and get a post-op appointment.